Me and Dr. Kaufman, we had interviews, and these interviews are still going on. We decided not to mask ourselves completely like this, as you see in the screen, because we wanted to take that risk. We agreed not to mask so that people can see us clearly and we can speak words clearly without being interrupted by the mask. So we took that risk for the purpose of saving the community. At the same time, we did not have enough social distancing because we wanted to stay much closer so that the cameraman can take that well as having a good conversation. But however, we did this, but before we had social distancing and we had masked ourselves. And after the interviews, we masked ourselves and we kept social distancing. Thank you very much. Please keep watching WordOut channel. Nice to meet you, Doctor. My name is Emma Yakam from the community of refugees and immigrants. I work with the refugees as a medical case manager. I'm here in your office to have a conversational communication which will help the community to understand. The reason why I'm here is just to discuss with you a few things regarding COVID-19. We want just to have better communication to all refugees and immigrants to understand what does this mean.
My name is Dr. Kaufman. I am a physician here in Chicago. I'm also the medical director of the Antioch Health Center, and we are the largest refugee clinic in the state of Illinois. I'm a board-certified physician in internal medicine and in pediatrics. And I've been working with refugees for 20 years, so it's always a pleasure to interact, to teach, and to connect with the refugee community.
My question is, what does COVID-19 mean and how people get COVID-19?
So the coronavirus, the current coronavirus, which is COVID-19, is an infection. It's a virus. It is related to the common cold, which means it's very, very easy to spread from one person to another, just like the common cold. It's a cousin of the common cold. The way it is spread is by droplets. So for example, if somebody who is sick with the infection coughs or sneezes, the sneeze and the cough give out droplets that land on surfaces, on people's hands, on the table, on an iPad, on a phone. Somebody who is healthy then touches that surface and without realizing it, touches their face, their nose, their mouth, and gives themselves COVID-19, gives them the coronavirus.
How do refugees and immigrants understand COVID-19 based on your experience working with refugees? You say you worked with refugees for how long?
20 years.
20 years, that's
20 years.
That means you have experience with it.
There's a lot of good information and there's a lot of misinformation in the community. People oftentimes know some of the symptoms, not all of the symptoms. Some people have some suspicions about where this came from, most of which is not true. So there's a variety. Some people are very knowledgeable because they've paid close attention to the media, and some people not so knowledgeable because they've been talking to their friends and watching on Facebook theories about where this stuff comes from.